Sometimes I think we overemphasize the impact that our childhood trauma or our advanced childhood experiences have on our adult lives. And we usually do this when we're dealing with a really difficult situation that has persisted for a really long time and we're unable to find a solution for it. And because of that, we're beginning to feel helpless and hopeless. And that's why we attribute our inability to cope in that situation to how we were wronged when we were children, how we were unjustly treated, unfairly treated in childhood, how we were not loved, how we were made to feel unimportant, invisible in childhood. And that kind of justification, that kind of thinking can be helpful in the moment in reducing the emotional burden in the difficulty. And so it suits you, very quickly through the difficulty, because the justification is that a long time ago, when you were a child, your caregiver who was supposed to help you, who could have helped you, didn't help you. That's why you're in this situation where you can't help yourself. A long time ago, your caregiver, your primary caregiver who was supposed to love you, didn't love you. That's why you're in this difficulty now. And like I said, in the moment, it does soothe the difficulty. But at this point, when you're experiencing the difficulty as an adult, you're probably the same age that your primary caregiver was when they were supposed to take care of you, and they didn't take care of you. At this point in your life, when you're facing this difficulty, you're probably in the same set of circumstances, in the same set of opportunities and challenges that your primary caregiver was when they were supposed to take care of you and they didn't. And so when a person dwells on finding fault and blaming their primary caregiver, then it keeps them stuck in that situation, because it's like they're waiting for their primary caregiver to come and get them out of this difficulty as adults. And they might not know that that's what they're doing, because this person has regressed in their thinking and they're beginning to see themselves as hopeless as they were in childhood, as defenseless, as powerless, as not having any autonomy. And so they're waiting for somebody to come and get them out of this difficulty. And I think this is the point where people are beginning to say that modern therapy is toxic, is because sometimes a therapist gets stuck in this cycle of blaming and fault finding. And like I said, it's very soothing. So the first session, if you're able to identify who did this to you, to your patient or to your client, it instantly makes them feel good. And so they're going to come back for that good feeling. It's like treating a headache because of malaria with Panadol, with a painkiller. Yes, you're going to feel a bit of relief from your headache, but it's going to keep coming back because the malaria is not being treated, is not being addressed. And so in this case, it's the same. You go to the therapist and yes, the therapist says it's not your fault. Yes, it was your parents' fault. Yes, it was your mom's, it was your dad's, it was your caregiver. It's not your fault at all. That's true. And yes, it's helpful in the moment in reducing the emotional burden, but it's not useful at all to the patient, to the client, because they're still in the difficulty. They're still stuck in that difficulty. Every time they get out of your office, they're going to face that difficulty again on their own. And so you want to be able to enable this person to see that they're now an adult. Like I said, they're the same age that caregiver was when they were taking care of them. And they have the ability to make a different choice. They have the control now, and they want to be able to see how much control they have over what. They have the power to make decisions, to make choices, to make different choices. You can help them rebuild their resources. You can help them restore their resourcefulness, to be able to know that they have to get themselves out of that difficulty. There's no one coming to help them. They have to find some strength in them to get themselves out of it. And the other thing I want to add is that the way that you want to go about it is to look at the challenges you're facing as an adult and why those challenges are making it hard for you to deal with them, and come back slowly to see where the root cause is. Sometimes the root cause doesn't trace back to childhood. It actually just goes back a little bit to a recent moment, maybe 6 months, 1 year, 2 years, 5 years. And because many people now overemphasize on advanced childhood experiences, it's always, I'm facing a challenge now, I'm a people pleaser, I can't say yes, then this has to come from childhood. No, sometimes it might just come from maybe 2-3 years ago, maybe 6 months ago, and you want to be able to come back slowly to see it, because you want to solve the problem. You don't just want to find blame and find someone to fault find. You actually want to get yourself out of that difficulty. And so the work is to come back slowly, and you might realize that maybe 2 years ago, 3 years ago, the reason why you're finding it difficult to say no is because you were able to say no before and you were able to face the consequences. But 2 years ago, you're not taking very good care of your mental health. And so your thought process started getting distorted. The way that you see reality started getting distorted. And so those 3 years ago, you said no to somebody and they took it very badly. And they became very defensive, and maybe you valued that person and they ended the friendship. And so your thinking from that interaction shifted, and not realizing that the reason why your thinking was able to shift from that interaction is because you're already at a weak position. You're already at a position where you're susceptible to have your thoughts changed, to have your assertiveness in saying no changed. And so being able to see that and to acknowledge that this is an adult problem that started in adulthood and that has led me into this difficult situation that has got me stuck, then you start looking for ways to come out of it. And so it's very important to try as much as possible to first look at adult problems, the things that you're facing right now, and to try and trace them back to where they originated from. And sometimes it doesn't end in childhood trauma. In fact, in a lot of cases, it doesn't go back to adverse childhood experiences. It just goes back to maybe when you're an adolescent. It just goes back to maybe your early adulthood. And this is very important in helping you build resilience. Find your strength to be able to recover from that ordeal or that difficulty.